Hello, welcome to this week's edition of NHIS in a Week. My name is Bernard Okoboi. Coming up in this bulletin, NHIS Chief Executive Dr. Bernard Okoboi reprimands healthcare service providers. Also in this bulletin, NHIS raises Ghana flag high in Ethiopia at a 3-day global discourse on primary healthcare financing. Still in Ethiopia, and the Health Agency of Ethiopia lauds Ghana's health insurance capitation model. And also, NHIS CEO pledges full support for incoming results for development president. Stay tuned for the details. Thanks so much for staying. Now to our first story. NHIS Chief Executive Dr. Bernard Okoboi has reprimanded all credentialed healthcare service providers to be transparent with the public on claims payments made for services rendered to active members of the scheme. Dr. Okoboi was addressing the opening ceremony of a training program sponsored by the World Bank here in Accra.
We are not honest at the table. We can decide to pay 10 times what we are paying today. We'll still have challenges. And recently, my roommate in medical school sent me a message. Now, some med suits said when we met at the ministry, I said, why are they taking monies and all that? That I have no idea the sacrifices they are making. I've also been, forgive me to use that word, is advised. I've also been a village doctor before. I've worked in the district. It's a lot of sacrifice. It's very challenging. You are on your own most of the time. It's true. But our business here as health insurance and as providers is to grant access. So once we credential your facility, we have a contract that when the ordinary Ghanaian comes to you, they can access healthcare where money will not be a barrier. Beyond paying claims, claim arrears, we revised our tariffs. And some of you here know that the amount you are receiving, some have gone up by 50%, some have doubled. If we'll be frank with ourselves. We are doing all this not for the fun of it, but we are doing this to make sure that we are on the same page so that the Ghanaian can have access. True access, not access that is on the screen. Health insurance, your access to healthcare. That's what some of us, we are realists. In our work, we want to be true to the situation. And I made a comment when I met the med soups. If you are med soup, you are here, we appreciate your sacrifice. But just as we appreciate your sacrifice, we also cherish the life of every Ghanaian in this country. So this is my position. If you are so convinced that what we pay for cesarean section is not enough, don't charge in the dark. Publish your charges just as I have published mine. Any servant or businessman who has justification for what they do and know that their heart is right, they don't keep things in the dark. They show it to you. If we really want to solve the problem, we have to be true to each other. And so I'm not saying that you are not working for Ghana, but let me know what you take. So that at National Health Insurance, if I even have to get another policy to pay for the vulnerable who cannot afford that levy you take, I'll find a way to pay for them so there can be true access and not virtual access to healthcare.
So that was NHIS CEO Dr. Bernard Okoboi speaking there. Well, the participants of the training were from the Ghana Health Service, private healthcare providers, Christian Health Association of Ghana facilities, staff of NHIS, Greater Accra Regional and District offices, among others. The World Bank Group support aims to improve NHIS active membership drive as well as claims submission, processing and payment for Tier 3 service providers such as health centers, maternity homes and CHIPS compounds. World Bank representative at the opening ceremony of the training, Mr. Enoch Uti Ejekum, had this to say.
We are very excited to be part of this initiative today because we believe that the primary level of the health sector is very critical towards achieving UHC. To achieve UHC requires three important things: to make services available, make them accessible and affordable. And these three things require very formidable health financing mechanism, for which reason we see the NHIA as a very critical agency within the health sector. The vision to achieve UHC also closely aligns with the World Bank's country strategic framework of ensuring that quality services are delivered to the population of Ghana. Available data from the public expenditure review conducted by the World Bank indicates that, excuse me, over 80% of the NHIA facilities are these health centers, maternity homes, and CHIP compounds.
Now, one of NHIS's key partners, the Christian Health Association of Ghana facilities, were represented by Dr. James Dua, who is the Deputy Executive Director. Well, he lauded the NHIA and World Bank for putting together the training.
For expedited claim processing and submission. When Dr. Salah mentioned the appreciation for payment, I think it is good. He was appreciating the good trajectory. And as Oswald said, NHI is getting more energetic and vibrant as the CEO himself. And I think it's good. If you compare time past and now, I think the payment is more forward-looking. And if you do data analytics, you need 3 points to establish a trend. And so far we have had that 3 points. And the trend looks good, and we are hopeful. And we are hopeful that this training will also contribute to enhanced processes and early payment.
Now, moving on, and a four-member delegation from the National Health Insurance Authority on August 16 represented Ghana at a three-day global discourse on primary healthcare financing in Addis Ababa, Ethiopia. Now, the Deputy Director for Research, Monitoring and Evaluation, Mr. Collins Ikuamwa, led the team that joined health experts at a high-profile meeting which sought to review the existing primary healthcare, now financing reforms, and to provide targeted technical assistance for solving identified challenges. The meeting also served as a platform for knowledge and evidence-based dissemination on PHC financing, awareness creation, bottleneck identification, context-based technical recommendations, and the development of an action plan to implement recommendations. The team interacted with some participants of the global discourse after the event. Now let's still stay in Ethiopia, and the Ethiopia Health Insurance Agency is using Ghana's earlier National Health Insurance Scheme capitation model to enhance health financing. In 2022, Ghana introduced capitation payment under the NHIS, which was piloted in the Ashanti region and extended to the Volta, Upper East and Upper West regions, with a key objective of controlling outpatient utilization and claims expenditure. Well, under the capitation system, beneficiaries of the NHIS were made to select and visit only one health facility, referred to as a preferred primary care provider when in need. Ethiopia's senior health financing officer with the World Health Organization, Tesfaya Mesele, lauded Ghana's earlier capitation model, hence the need to adopt it in improving that of Ethiopia.
Ghana has been implementing health insurance within the continent as a pioneer, and as a new starting country, we thought it would be a very practical knowledge that Ethiopian colleagues can bring from communicating with Ghanaian colleagues.
It's a pleasure to have a discussion and experience sharing with the Ghanaian National Health Insurance system. So in the capitation, we are in a pilot phase. And what I learned from the Ghanaian experience is that the fact that there was a communication issue and you need to address the communication part well is something that we need to do a lot on. We are in the pilot phase now, so communicating the payment modality for the providers, for the community, the beneficiaries, for the local implementers would be something necessary. So that is one good lesson that I took.
Well, moving on to other stories, and the incoming president of Result for Development, Jenna Logo Marisono, Together with the outgoing Ghana Country Director and Senior Program Director, Dr. Linda Van Notu, and other officials have paid a courtesy call to the NHIS Chief Executive, Dr. Bernard Okoboi. Now, the parties discussed some programs that both entities are working on in the areas of research into out-of-pocket payments, integration of preventive care and health promotion onto the NHIS benefit package, and streamlining credentialing systems between the NHI and HEFRA. Dr. Okoboi welcomed the visiting team and pledged the NHIS support for the interventions being worked on to assure them of how useful the research findings will help inform management on how to proceed with some of the challenges bedeviling the authority. Well, to some other stories, and the NHIS Chief Executive Dr. Bernard Okoboi on Wednesday, August 24, inaugurated EPlanning Committee to oversee preparations for the NHIS 20th anniversary celebration schedule for the end of the year 2023. The 9-member committee will be chaired by the Deputy Chief Executive in charge of Administration and Human Resources, Dr. Mrs. Yapukwa Bedin. So the other members on the committee are the Director Innovations and Special Project, Mr. Raphael Segbep, Director Private Health Insurance Schemes, Alaji Hudu Isa, Acting Director Procurement and Project, Mr. Frankie Abua, Acting Director Budget Management Accounting, Mr. Richard Ajiman Bedu, Acting Director Corporate Affairs, Mr. Oswald Eswa Mensah, Acting Director Strategic Health Purchasing, Dr. Ruby Eileen Mensah Anan, Mrs. and Deputy Director Investment, Eva Okai, Mrs. Eva Okai, as well as Acting Ashanti Regional Director, Mr. Kujo Jumo, Lawyer Abdul Mujib Isa Kele, Acting Manager. The Legal Directorate led the committee members to swear an oath of secrecy. Dr. Okoboi charged the committee to work within time and ensure that the nationwide celebrations come to fruition. Now, the Chief Executive, Dr. Bernard Okoboi, has inaugurated 2 newly built projects in the Western North region. Now, these are the Western North Regional Institute, also National Health Insurance Scheme office complexes. Speaking at the inauguration of the Western North Regional Office, Dr. Okoboi thanked NHIS staff in the region for achieving 80% of their set targets of the scheme's active membership. He also encouraged them to go the extra mile and attain 100% in line with the national agenda of universal health coverage.
We must come together to make sure we don't target 80%, but we work towards 100%. Because that 1% can be your brother or sister, and you can be hungry or lack food for a day, but you will not die. It is possible someone will give you food tomorrow morning. You can be sleeping outside for a day or 2. Shelter might come in a week, you will not die. But if you are sick this afternoon and you don't have cover, before morning comes tomorrow morning, it would have been gone too soon. And so I agree with Dr. Fee. We must work towards freeing all the funds meant for healthcare. There must be no cap. Because many things are important, but even amongst the important things, your health must come first. And I believe strongly that when we all discuss and work together, all these issues will be resolved sooner than later.
Now, Member of Parliament for Sefiri, also Dr. Kukwefiye, who was at the event, lauded Dr. Okoboi for his leadership since taking over as CEO of the authority.
We are fine with the formal sector. Now, for the informal sector, no, you are fine. Ghana, they are unique. Now, and then I'm in the CEO in Komo. Say, no, but ya tank. When we say we tank, I say, you tea ya popim. You want to maybe say, yeah, through universal. It is where the applicant health insurance from paying for our hand. As MP for Sefiri, also now with all, humility, about person, we will now be liaising with them. With a free source, and not has part of it. Said a bit me a universal healthcare. Regional at the whole cannot cancel universal healthcare, Mr. Meka, and your population. Who your health accounting will be physiology now of physiology not by also government hospital. A car born different from Ubi autism military, no apple you also government hospital. All those things should be taken into account. The financial barrier. And I think drug coverage. Say new drugs are coming. My suggestion to see you will say, young form a standing committee they be unbearing you. And then me and my band also. I've been a friend of the NHI wherever I found myself. Indeed, me na me internal critic. Inti me ma buy me the so na me wash my buy. I better say be me NDC ni because I know the potential. What the likes of CEO what do you call it? Yura Okoboi Obetmaye. It's a young man, very very spirited. Now at this stage, you know, can say doctors, nurses, near what healthcare for you find any politics more because that's the highest decision making body in this country.
And that's it for this week's edition of NHIS in a Week. Thanks so much for watching. My name is Bernard Okoboi. Do remember to always follow us on all our social media platforms, on Facebook, now X, former Twitter, and then on Instagram as well. You can also get more stories on our website at nhis.gov.gh. Thanks so much for watching.